So when I'm teaching people to learn how to discern, how do we teach them to assess what's going on in the body? I think that one of the I don't want to call it the biggest mistakes, but one of the biggest challenges I think people have with assessment is that we tend to be a little bit rough with our assessment process. So for example, I'm checking the shoulder, and so we say, okay, I'm going to check the range of motion here in the shoulder and just see what's happening. And I might as well just be taking an injury and punching it and say, how does that feel? And we wonder how the body might respond to that. So all joking aside, when we begin to assess an area that we are determining what's going on here, is this pain, is the area injured, I think the best way is to very gently knock on the door. So for example, let's take the shoulders. This is a common issue for people. So we make a really gentle assessment, nothing that's going to necessarily aggravate the tissue, right? And because we don't know what we're going to find, we move slowly. And we can do this with any body part. I might begin by just gently rotating or shifting the shoulder. And I'm just kind of assessing, not just for what the sensation is in here, but how is my nervous system responding to that sensation? Do I brace? Do I hold my breath? Is something sharp? And assuming we don't have this massive acute injury, which you wouldn't be moving anyway because you'd be at the ER. Assuming I don't have a massive injury, doing tiny movements like this, the likelihood that it's going to re-injure me or make it worse is low. Now, this is not a medical conversation, so that is a generalization, which I urge you to take at your own caution. So I assess. How is the smoothness of a movement? Do I feel pain or discomfort when I'm there? Do I notice that that movement feels creaky or rusty? Is it smooth? Am I breathing? All of these questions are things that I'm asking when I'm doing a gentle assessment of the body. And I could do that with anything. I could do it with my lower back. Let's say I was assessing lower back pain. Now, like I said, there may be situations where you won't be able to do this. If you've thrown your back out, you're not going to be doing these assessments because you will have called your doctor already. But we can just kind of feel, what's here? What am I noticing? And you do the same thing as you might do for your shoulder. And then from there, that becomes your springboard where you can start to explore gentle movements. And that's beyond the scope of this video. But I might do a movement, and then I would come back to that really gentle assessment again and just say, okay, what changed? Do I feel like the movement is any smoother? Does the range of motion feel different? Does my relationship with the sensation feel different? Because we want to be careful to not too quickly label it as, oh man, this feels tighter now. Because sometimes we can feel that something feels tighter, and yet we check the range of motion and it's actually improved. So we don't want to rush to conclusions about what we're feeling. Similarly, I generally ask people to not stretch right after doing something, especially if you feel this impulse to want to do it, because sometimes that's the body just trying to find its way back to what it perceives as its comfortable neutral, when what it really needs is to experience that new set point. So these are just some things that you can think about in your own assessment process as you work through injuries or challenges in your practice. And the likelihood is that you'll need more guidance than what this video is giving you. But hopefully it gives you some context for you to explore how to perceive your body and how to work with it as opposed to how to fix a problem. Okay? Hopefully this is helpful.